oh yeah, I still have a little bit of breathing issues. Again, we can then address that inflammation that's still present in them, but it's going through the whole form again. But that doesn't happen in a 5-minute traditional
Right.
provider
Well,
visit.
I think I don't think patients believe that their medical providers actually look at their medical history anyway, because in a lot of cases
Yeah.
they really don't. So they just think like, how fast can this is just a thing, like how fast can I get it
Correct.
done? And, as accurate as I can be, then, whatever else. But, they're used to doctors and providers not caring, not looking back at the forms, not confirming or, asking those deeper questions about
because
that.
it was coming out off the blood work anyway. They were looking at the lab work and making a
Mhm.
diagnosis and prescription.
Yeah, let me just
Well,
go
again, this is where it comes back. You're normal, you're normal, you're normal, you're normal. I don't feel good. Here's an antidepressant.
Yeah. Tim, I want to play a game with you. Can we play a game?
I'm into games.
Okay. So you're going to give me a scale from 1 to 10, 10 being, or 1 being useless, 10 being phenomenal, and actually 5 mid-range. I'm gonna give you some peptides and some pretty common anti-aging treatments. So just off the top of your head, just skim through this real quick. You ready? Scale from 1 to 10, 10 being the best. Methylene blue.
5.
Cold plunge.
7, 8. Depends on the person.
Samorlin.
3. Can I pick Tesamorelin or CJC, please?
Tesamorelin's next.
9.
Okay, beautiful. Berberine.
11.
Wow.
Underutilized.
Agreed.
And we don't use berberine, we use dihydroberberine, which is an active metabolite of berberine, 5 times more absorptive, less dosing. Some of my 75+% of my patients are on what we have in our brand called Carbex, which is dihydroberberine.
Nice. Creatine.
I just started playing with creatine about 3-4 months ago. I love it. 6, 7.
Yeah, great. Testosterone for men.
15.
Testosterone for women.
27.
And vitamin D.
Even more important, because the women are gaslit, it's normal to have low libido. It's normal to feel this way, and it's frustrating.
All right, so
I think most husbands would say testosterone for women is a 27 too.
Hell yeah.
Mine would.
Look, we have a program called Red Hot Monogamy, and we highly recommend that you get your hormones tested before you do the program. So that list that I just gave you, when we have this conversation with conventional doctors, they don't know what half the things on that list were. So what does that tell you moving forward?
Again, that's the knowledge. That's the, and this goes back to, I don't have personal battles. My patients are put in the middle from their traditional doctor. They're on testosterone therapy. They go to the cardiologist. Why are you on testosterone? It's going to cause a blood clot. Then they call me. He said I'm going to get a blood clot. Or their thyroid isn't optimized. I have them on a NP thyroid. Their TSH is low because they're on thyroid medication. They call me, Tim, my doctor said I had to stop my thyroid because I'm in hyperthyroidism. Did they tell you that your TSH was low? Yeah, how'd you know? You're not the first person that's called me. I'm like, where's your free T3? Oh, they only draw TSH. I'm like, you can't make the determination that you're in hyperthyroidism on one number alone. And then the second question is, did you hold your thyroid the morning you drew the lab? No, they had me take my thyroid. So you took your thyroid 2 hours or 3 hours before your lab. Your levels are on the way up. That's not even an accurate number.
Yeah. So I want to go, we just finished these formal questions. Just tell people where they can get a hold of you. How can they find you?
Yeah, so we're Health Matrix. You can go to healthmatrix.com. We're located in Lake Mary, Florida, which is a north suburb of Orlando, Florida. We are in Gainesville, Florida, My Health Matrix Alachua, and we are getting ready to open a flagship clinic in Las Vegas. It's going to be My Health Matrix Las Vegas, hoping to open that facility sometime in the October timeframe.
Awesome, Tim.
Come to Georgia.
Well, we are absolutely looking for expansion, and we will be expanding as we continue to grow and find providers.
That's great. So that's what I'm going to cut, but let's catch up for a little bit here. So what is the long-term goal for you here now?
I gotta go. I'm gonna go real quick.
Go ahead.
So again, we've known each other for a minute. A lot of my friends, a lot of my people who know me know I have a different sort of brain. Not many of my provider friends would be comfortable to do what I've done and be a 50% owner in a clinic here in Orlando, 50% owner in a clinic in Las Vegas. I have a 30% ownership in a clinic in Altamont Springs. Gainesville is an affiliate with us. And so really what that structure for us is, they pay a fee, we have a training program, they then have access to me ongoing. We get a monthly percentage of their gross revenue.
That's great.
And the way when they grow, we grow. And we're continuing to look for other providers. We have a clinic in practitioner, not a clinic practitioner in Detroit, Michigan, somewhere suburb. I don't know Detroit, but they told me this. And I'm like, okay, Detroit. They're looking to come on board. We kind of put them on the back burner because right now we're working on the Vegas clinic. Once we get Vegas open, then we'll move and go to Detroit. We're developing a relationship with a clinic in Orange County, California. They have biohacking. They want to bring medicine in. We're getting ready to engage them to bring medicine in. They are a training hub for multiple clinics throughout the US who do biohacking. She wants to turn us on to her network. So that'll be an avenue of expansion for us. We have a private set. One of the things when we launched the clinic, we launched a private label supplement company that we do well with. Right now, we have about 34 products that we manufacture. This year, we didn't talk about on the podcast, we have brought biohacking equipment into my clinic. We have red light cabins, we have infrared, far infrared tents, we have vibrogenics frequency machines, I have Catalyst EMS suits, I have EWAT therapy, exercise with oxygen, and we're bringing in a dry cryo bed. So again, the cold plunge, and the reason I said 5'6", love cold plunge. I love cryo, hate being cold and wet, but I like cryo. This dry cryo bed allows my patient to get cold without getting wet. And those are all things we're bringing in. And then in Vegas, we have a hypobaric chamber that we have. And if I had room, I'll grow my clinic. I am maxed out. I can't put another piece of equipment in my current clinic or I'm going to have to move. If I had room, I'd even put that hypobaric chamber in my office. I want this hypobaric chamber. The potential is ridiculous. The one that we purchased takes you, again, you guys know hypobaric, cycles you up and down almost to the height of Mount Everest.
Wow.
To put stress, to cause erythropoietin generation, more red blood cell formation. And so where do athletes go train? Colorado. Why? Altitude, red blood cell formation. I now bring Colorado to Las Vegas. I bring Colorado to Orlando, Florida. You just sit, you cycle, you stimulate more red blood cells. Athletes, weekend athletes, triathletes are going to benefit from that. It's going to be amazing.
What are the peptides you're doing right now? What are the main ones?
Which ones am I not doing?
Well, there's a lot. I mean, are you into the Pinoleon? Are you into the TB500? Into the
Pinoleon, epithalin, GHK, copper, although right now I can't get the copper, I have to use the acetate, which I'm not as big of a fan of because acetate has to turn to copper. Esomorelin, CJC, I'm not a big fan of Somorelin. Now that I have access to CJC again, I don't have to use Somorelin. You asked about methylene blue. Methylene blue is okay. Methylene blue is like jumper cables. I use NAD, but even more impressive, I use SS31. And SS31 is ridiculous. And I looked for it for 2 years once I started reading about it. I found it last May. I had been on NAD for 4 years. I transitioned to SS31 from a kidney and a reconfiguration piece. I use GLP-1s, but with GLP-1s, if you're not going to change your diet, if you're not going to change your habits, I don't put you on GLP-1s. I refuse. And I put people on my Tanita body comp scan. If you lose your muscle mass, I turn your dose down.
Yeah.
I use a kind of PT141. I mean, you
and
name
like
it.
PT141.
You name it, I'll play with it.
Yeah,
I use about 6 or 7 personally on a rotating basis. Pentadecapeptide, replacement for BPC, fabulous. TB500 post-surgery, pentadecapeptide, TB500 run as a stock.
Yeah, we've been using the PDA quite a bit on the injection. We're still okay with the BPC for like the gut health for the oral.
Oral BPC, I can still get BPC caps. I can't get BPC injections, but I have access to caps, absolutely, from a gut health perspective, twice daily for up to 90 days.
Yeah, and it's exciting with the research that's coming out with some of these, with what it's doing to the mitochondria in the cell. I
Yep.
mean, it's mind blowing how that's actually age reversal.
Yep. And I tell my patients all the time, you want to have a conversation about anti-aging. If you're not addressing the mitochondria and you're not addressing the Krebs cycle, you're not addressing anti-aging. Period.
Yeah, so is that kind of where you're full steam ahead right now? Is anti-aging, opening up centers, training centers, not franchises, but licensing affiliates? Nice. Well, you killed it, man. I really appreciate you doing this for us today.
I hope I did well.
Oh, you did great.
Did. It was awesome.
You're our first one that we officially, that we wanted to get somebody that we were comfortable with, we knew was an expert. So this is perfect.
Yeah,
Awesome.
we've been guesting on. I did 3 this week. We've been guesting on podcasts and just having a blast. And we're like, why are if people want to hear from us so much that we're asking to be guests on all these podcasts, why aren't we doing our own podcast?
Nice.
Here's what we want to do.
Yeah.
I mean,
There we go.
keep your eye out for this. I mean, we're going to move into the coaching space, into the mentoring space, but it's not going to be about programs. It's going to be about education, this type of stuff. And it's going to really, what we're going to try to do is, or at least on the wellness side, is bridge that gap between fearfulness from people trying to step out of the insurance model and step into this. And you were spot on with your recommendation. Half a day one, do 2 days a week, and then just build that schedule out.
Yeah.
Yep. And they have to get their labs. So when I train my providers, the first day that they're here, usually 8 o'clock in the morning, it's their lab review.
That's how we did it.
Yeah.
Before
how
they
we
do
did it
any
with-
training, it's their lab review.
That's how we did it with our nurse practitioner. We sent her to Sejun, and she had a full workup and went through the whole process there before she even started. Yeah, and that we have a client that we're working with right now, and she's like, I don't understand how to, how much time and how to charge for the providers. And I was like, okay, what? And she's like, yeah, well, I have my testosterone injections. They're sitting on my desk. They've been sitting on my desk for 2 months.